This video is about opioid safety and disposal. You may have heard a lot about opioids in the news recently, and you may have some questions. The pain doctors at Lurie Children's Hospital share your concerns. We made this video to try to answer some of the most common questions people have. What are opioids? Opioids may be used as pain treatment, especially for moderate to severe pain, and are often used to treat pain after surgery. Opioids are a type of pain medicine that doctors prescribe for pain that cannot be fully managed with over-the-counter medicines. Your medical team will work with you to create a pain plan specific to your child's needs. If opioids are needed, your doctor's goal is to use the smallest dose possible to treat your child's pain. How do I use opioids safely? The following 3 safety rules should be followed to avoid opioid misuse. Rule number 1. Always take opioids exactly as prescribed. Follow the recommended dose and instructions on the label. If you are confused by the label, ask your clinical team. These instructions are written by your clinical team based on your child's age, height, weight, and medical needs. Rule number 2. Only give your child the specific opioid medicine prescribed to them. Never give your child opioids that were prescribed to someone else, and never give someone else your child's medicine. Your clinical team has chosen a specific type and amount of opioid medicine to help with your child's specific pain. If you have questions or feel your child's pain is not being managed well, call your clinical team. Rule number 3. Children should never take opioids when they are alone. This includes teenagers. An adult should always be present to stay with your child and watch for side effects, and to see how your child responds to the medicine. Not everyone responds to opioids the same way. If too much of an opioid medicine is taken, it can lead to serious side effects, such as slow or shallow breathing, and excessive sleepiness or difficulty being woken up. This is sometimes called an overdose. If you see your child show any of these symptoms, you should call 911 right away. What should I know about opioid misuse? Opioids are very powerful medications that can be misused in different ways. One potential sign of opioid misuse is taking more medicine than the amount your doctor prescribed, and taking the medicine for longer than your doctor recommended is another sign of opioid misuse. There is also a type of opioid misuse called diversion. Diversion means that extra or unused pills are taken from someone else who is no longer using them. Taking opioids that are prescribed to someone else or sharing your opioids with someone else is also opioid misuse. Diversion is one of the many reasons it is important to make sure these medications are stored safely, locked away from any teens or adults for whom the medicine is not prescribed. Another benefit of storing opioids safely is that they are out of reach from small children, helping prevent accidental poisonings. If you suspect someone took an opioid medication accidentally, you can call the Illinois Poison Center helpline at 800-222-1222. They are available 24 hours a day, 7 days a week, and provide free resources. What should I do with leftover opioids? Once pain is treated, there may be extra or unused medicine left over. It should not be saved for future use. The leftover opioids should be disposed of in one of the following ways. You can ask your local pharmacist what medication disposal programs they have. Most of these are free. Some pharmacies have kiosks where you can dispose of the extra medications yourself. Others have drug deactivating bags or powders that are mixed with leftover medication to destroy it. Another option is to remove any remaining opioids from the bottle and mix your opioids with something that would taste bad if eaten, such as cat litter or coffee grounds, and then throw it away in the trash. Also, make sure to scratch out your name and the prescription number on the medication bottle. Local police departments or medical facilities may host take-back events. These are great events where you can bring leftover medicines to be disposed of properly. If you have small children or pets and are unable to dispose of the medicine using the previous methods stated, you should dispose of the medicine as quickly as possible by flushing it down the toilet. Who should I ask if I have more questions? Please review your discharge instructions, where you will find helpful information and your clinical team's contact information. If you have any questions, you should call your clinical team. Remember, our goal is to provide the best care and safest pain relief to help with a quick recovery.